Hi, everybody. Welcome back to Conversations with Therapists. Today I'm joined by Dr. Michael Koren of Brighter Life Therapy. Dr. Koren, thank you for being here.
Thank you for having me.
Dr. Koren, you trained at the VA clinic and later completed a postdoctoral fellowship at Harvard Vanguard Medical Associates. What drew you to working with veterans, and how has that experience shaped the way you help clients deal with trauma today?
I've always loved working with veterans. The compulsion to give back to people that have served has been a lifelong journey for me. I grew up idolizing soldiers, Marines, and other service members and appreciated the sacrifices that they've made and began to see as I got older and went through graduate training that they really don't have the resources that they need, that they're often as strong as they've been in serving our country and as courageous and humble oftentimes they don't get the services and resources they need, and that often puts them in a very lonely, isolated position. And I just felt drawn to helping such a population and to be closer to their stories and to witness and help them feel less alone.
Brighter Life Therapy offers a range of treatments from CBT to EMDR to ketamine-assisted psychotherapy. How do you determine the best approach for each client, and what does personalized care look like in practice?
With every client that comes through our doors, so to speak, we always triage their needs individually. So if someone is a good fit for a certain type of evidence-based treatment, such as ketamine-assisted therapy or CBT or EMDR, whatever it may be, we're always going to determine what their goals are and how appropriate a fit certain treatment might be. And then from there, we can offer them options. So we can say to them, would you like something that's more structured or something that's maybe a little bit less rigid and flexible? It's just sort of based on the needs of the individual.
So there are a lot of people who still aren't sure what modern therapy looks like and how it's evolved. When someone comes to you for anxiety, trauma, or depression, what can they expect from the process, and how soon might they start noticing changes within their own lives?
That's a great question. So obviously everyone's different, and I know that from experience, having worked in the mental health field for over 13 years, most people feel some sort of effect from therapy within the first 3 months. But oftentimes it can even be the first 1 to 3 sessions that they might feel a sense of relief and, okay, I'm not struggling by myself anymore. I'm not alone with this, or I'm not going crazy, that there are other people that experience this. And I think sometimes just clarifying what the problem is and having an idea of what to do about it, that there is something to do, can be hugely relieving for people. But that said, I think the average amount of time spent in therapy in our clinic is somewhere between 3 and 6 months.
There was something you said that kind of stuck out to me, which was getting to the root of what the actual problem is. I feel like sometimes people come in with a whole laundry list of things in their life that could not be going as ideally as they could be. I feel like part of therapy in general, but specifically the work you guys do, is really whittling down what the actual root problem or problems are. And sometimes they can even be connected. I mean, I'm wondering from your perspective as the therapist, what you've noticed in terms of being able to sort of get to the root of things and seeing how problems could potentially be interconnected, and kind of sort of like a roadmap almost when it comes to
Right.
treatment.
That takes a lot of time sometimes. First of all, someone has to be comfortable and courageous enough to come to therapy and open up. And that by itself is a win, right? That's retelling your story. Maybe they've seen other therapists, maybe not, maybe it's the first time. Whatever the case may be, just arriving and unpacking is by itself an accomplishment and a struggle. And so I like to really make sure that we honor that part of it to begin with. Then the journey of pattern recognition, or finding, how should I say, finding meaning within one's narrative and a thread, is, at best case scenario, a collaborative effort between the therapist and the client. And that's what's so important, is that it's not as if the therapist is some expert on the client's life. It's the other way around. The client is the expert. And the way I treat it is that I'm honored to be here witnessing that story, that narrative. And it's almost like I'm a guide where I have a flashlight and I'm like, hey, let's look over here. What is that? And together we uncover things that might be hidden or might be a roadblock, an obstacle to one's growth. So that's sort of in a nutshell what therapy can be like. Of course, it's much, much more detailed, and it's even more so than I'm giving it credit for.
Your practice, Brighter Life Therapy. You grew it from a solo practice into a team serving clients across Greater Boston. I have a
Mhm,
couple of questions.
mhm.
First, what inspired that growth and what values guide the work of your clinicians today? And also, how did you come up with the name Brighter Life Therapy? And how does the name of your practice sort of guide, like I said in the last question, guide those values of the clinicians in your practice?
Excellent question. Yeah, I think that's something that a lot of people like to know about the history of Brighter Life. Brighter Life came from a couple of things that are very personal to me, and I don't mind sharing them because more than don't mind, I like to be open about and vulnerable with my own struggles. So in 2017, before I started my practice, I was really struggling with feelings of depression, isolation, and loneliness in my own life. And I think when I found a good therapist that was a good fit for me, and I was really able to open up, I remember seeing my provider for the second time, and they said, "Gosh, you look brighter." And that really dawned on me, and I was like, "Wow, someone else is noticing something that to me was sort of hidden, or perhaps I didn't notice it." And I really like that word because they weren't saying, "Oh, you're less depressed," or "You're happier." I mean, how non-specific is happy? Like happiness can be a moment. It could be mistaken for joy, right? But brighter, it was like, no pun intended, like a light bulb moment for me where I was like, you know what? That makes a lot of sense that I feel it and I connected with that imagery. And so I carried it with me. I probably forgot about it for like a good year and a half until one day I started Brighter Life Therapy, started private practice, and then I was like, well, what should I call it? And I thought back to that moment because I wanted to make it connected to my personal life. Authenticity is so important. And I want people to know that they're seen and that they're heard and understood, first and foremost, and that we as providers are humans. We struggle with some of the same things that the clients do. And we oftentimes have our own therapists and have been through our own struggles and traumas. And yet we can still be present and still provide this incredible service. I was working in a community mental health setting in early 2019, and someone said, "Dr. Koren, why don't you just start your own practice?" And I said, "Oh, that's too difficult. That's for people with much more experience and expertise. There's no way I could do that." And they said, "Well, why don't you just get on a few panels and offer insurance-based care through Blue Cross Blue Shield and Aetna?" And I said, "Okay, I'll give it a try part-time." I opened up an office in the middle of Harvard Square in Cambridge and rented a very small space for a few months. And I was immediately just struck by how full my practice was. Within a few weeks, I was serving the needs of the communities of local Harvard students, undergrad and graduate students. And I got on these referral lists for the local colleges and universities. And that became how I started my practice, was serving their needs. Then the pandemic hit. We all went virtual, but there was such a great need. There was such a demand for therapists that I said to myself, we really need to make sure we're offering insurance-based care because so many practices in the area were just cash pay only. And there was that disconnect or divide that I noticed. And so that became central to my mission, was not just being a therapist, but being like forming a team around me of people that can complement my skills, trauma therapists, anxiety therapists, people that specialize in integrated types of therapy like ACT, acceptance and commitment therapy, and different interventions, and really develop an interdisciplinary team with licensed mental health counselors, psychologists, and others, where we could complement each other's skills as colleagues and consult with each other as a team to offer the best care that we can while still being insurance based and affordable for the community. So that's kind of how it grew. The team just attracted more and more people that felt that same way. And here we are.
Thank you for sharing. That was such a beautiful story. I was
It was so
tearing up.
long-winded.
No, it's really powerful, and that name is really, really special, and the story behind it is really powerful. So thank you for
Thank you.
sharing it. Outside of therapy, you enjoy hiking, photography, and college basketball. How have those interests influenced your perspective on mental health, resilience, and or personal growth?
Oh, great question. So, man, I mean, there's so many different types of things one can do outside of work. I think it's just so important to find your flow, to find something where you can do something and forget about the experience of time. And so, for everyone, that might be different. For some people, that might be hiking. For other people, that might be playing chess. It doesn't really matter what it is, as long as you can find that thing that just pulls you away from the stress of day-to-day life and into something where you can use your creativity and engage both sides of your brain if possible, your body. For me, hiking is about a full sensory mindfulness experience. I've always, from childhood, enjoyed being immersed in nature, especially a forest with like moss and green ferns everywhere, and just getting absorbed in that, even if temporarily. It's a beautiful, beautiful thing. And it brings me a great sense of peace. Photography, I think, because I'm not very good at painting or drawing, so it allows me to capture those things that people often do as the subject of their paintings and drawings, but there is a creative angle in how I do it, how I capture it, and I just enjoy playing around with the light. So having a black and white photo and just seeing how shadows play, basically creativity and play. That's a big part of it. Someone once told me that the opposite of depression is play.
Hmm.
And I thought that was brilliant because a lot of times if you ask people, including myself, when this person told that to me, they say, what's the opposite of depression? I would say happiness or maybe contentment, I think. And it's, if you think about it, it's really true. Like when we are held back, frozen or stuck in the past or perhaps in the future with anxiety, we are not open to play. You can look at it from a neurobiological angle. There've been a lot of studies that have shown that when our fight or flight mechanisms are on, then it's sort of incompatible with when they're shut off, we're able to play and let go. That experience is natural to us in childhood, but we need to exercise it again as adults. College basketball is just something I've always loved. I attended the University of North Carolina at Chapel Hill, and I'm in love with their basketball team. It's where Michael Jordan went, and I'm very proud of that. So that's just something fun I like.
Well, I feel like we only scratched the surface of all the incredible, important work that you do at Brighter Life Therapy, but I want to say thank you for being here today and being so open and candid and authentic. And I'm very excited for whoever is listening and watching to have gotten to get to know you a little bit better throughout this interview, and also have a chance now to reach out and schedule a consultation and really get involved and know that healing is possible. So thank you.
Thank you so much for that opportunity. And I hope that this helps at least someone out there connect with hope and with healing, as you said. Thank you.